Hello guys, today I want to look at hypertension, and with the hypertension we'll look at the definition of hypertension for this presentation. We'll look at the definition of hypertension, and then we'll state the three types of hypertension, and we'll also look at the 5 predisposing factors of hypertension. Okay, so to begin with, definition. Remember, I hope you have watched the video on how to write your definition. So the definition, for you to get 5 marks out of any condition, okay, you need to state 3 things. That is the cause of the condition, you need to also state what type of a condition it is, and at least 2 signs and symptoms. Okay, so here our definition for hypertension is a cardiovascular disorder that results from predisposing factors such as obesity, smoking, or pregnancy, characterized by systolic blood pressure of above 140 or the diastolic pressure above 90 millimeters of mercury. Then this should be checked with the patient in superimposition on 3 different occasions. Okay, with signs and symptoms such as headache, dizziness, visual disturbance, and palpitations. Okay, so those 3 things are there to complete your diagnosis, your definition, and get 5%. Okay, so what are the types of hypertension? We have the first one is primary, which is also known as essential or idiopathic hypertension. So this accounts for 95% of cases, and this is because it is idiopathic, the cause is not known. Then the other one is secondary hypertension. This is due to an underlying condition. So for example, maybe someone has got renal failure or someone has liver failure. Then if hypertension comes in, that will be secondary hypertension because of the underlying condition. Then we have the third type of hypertension, which is malignant. So malignant, this is more like a chronic type of hypertension. Okay, so it can either be as a result of primary or secondary hypertension, and it is very severe. Okay, and if untreated, death occurs within 3 to 6 months, and it is rare. Okay, so it is it is an emergency. If someone has this type of hypertension, they need to be treated in an emergency situation. Then what are the underlying causes of hypertension? We have 80 to 95% of each being as a result of unknown causes. This is idiopathic hypertension. Then we have pregnancy. Pregnancy comes in because of the increased blood volume and as a result of the growing fetus. Then we have obesity. This, because of the fat deposition, it will cause atherosclerosis. Then smoking, because of the nicotine in the cigarette, this can cause vasoconstriction, thereby increasing your blood volume. Then we have dietary causes. This is as a result of sodium intake. We know that sodium causes water retention, and then if water is retained, your blood volume is increased, thereby your blood pressure increases. Then other causes, we have stress. Someone is in a stressful or emotional state. Now if someone is in an emotional state, they tend to release cortisol. The body releases cortisol from the adrenals. Okay, so this causes blood glucose to rise, and if the person already has maybe enough glucose, and then there's this other glucose that has been released because of them being stressed, the extra glucose will be turned into cholesterol. Okay, now this cholesterol can cause plaque formation in the blood vessels, thereby increasing the blood volume in the blood vessels, thereby increasing the blood pressure. Then we have kidney diseases. So diseases of the kidney, these account for less than 5% of all hypertensive condition. This comes about and causes renin production to be increased. Okay, remember this one, if let's say there's a tumor in the kidneys, okay, it will cause the glomerular filtration rate to reduce, and once the juxtaglomerular cells detect that there's a reduced glomerular filtration rate, they'll start producing renin, and if the renin is produced, the renin-angiotensin-aldosterone system is kick-started, and then blood pressure is increased. So if you look at that, okay, here you have the nephron. So this one is just showing, for example, what happens in hypertension. Hypertension mostly is, let's say, blood flow that increases. It increases to it increases in such a way that if the pressure in the blood, okay, is flowing at a very fast rate, filtration rate here will be reduced. Okay, now imagine if there's a kidney disorder in the kidneys, there's whatever tumor or whatever is causing problems in relation to the already increased blood flow in the capillaries. It will cause glomerular filtration rate to reduce, thereby also renin starting to be produced. Okay, other causes and predisposing factors, we have oral contraceptives. Oral contraceptives mostly cause an increase in renin, and if renin is produced, we know it will cause the renin-angiotensin-aldosterone system to start, thereby increasing blood volume. Then another cause can be a tumor, okay, such as a pheochrocytoma in the adrenal glands. Now this type of tumor can cause an increase in adrenaline, and then adrenaline has a direct effect on the heart, causing the heart rate to increase. Okay, so like we saw on the nephron, if the heart rate increases, the blood volume increases, thereby reducing filtration rate because the blood in the glomerulus is passing at a fast rate. Okay, so that will cause the renin to be produced, and then we have the renin-angiotensin-aldosterone system to start. Okay, we've come to the end of our presentation. Please subscribe and share so that others can simply learn. Thank you very much.